are listening to the PGX for Pharmacists podcast, part of the Pharmacy Podcast Network. Pharmacogenomics is the study of how genes affect a person's response to drugs. This revolutionary science combines pharmacology and genomics to develop effective, safe medications and doses that will be tailored to a person's genetic makeup. There's no better healthcare provider positioned to leverage the analytical power of pharmacogenomics to provide more effective medication therapies and outcomes than a clinical pharmacist. And now, here's the host of the PGX for Pharmacists podcast, pharmacist, researcher, and national pharmacogenetics expert, Ken Sternfeld.
Good afternoon and welcome to PGX for Pharmacists as part of the Pharmacy Podcast Network. My name is Ken Sternfeld, and I am your host today. I am very excited to welcome a dear friend and physician who I've known for over 30 years, Dr. Michael Goodman. Dr. Goodman has been a board-certified physician in internal medicine since 1980, and he's practiced in the Merrick and Belmore areas of New York for over 40 years. He has established relationships with many specialists in the community and at leading hospitals in Nassau County, Suffolk County, and New York City, and is also affiliated with South Nassau Community Hospital right here on Long Island. Dr. Goodman practices as a concierge physician, something very interesting that I'm sure our listeners will want to learn more about. He offers personalized care and advanced clinical services to patients, helping them achieve optimum health. He's an internal medicine doctor, knowledgeable in all aspects of adult medicine, cardiology, endocrinology, pulmonary medicine, just to name a few. He's been recognized as a top doctor by Castle Connolly. His patients enjoy many conveniences not found in most medical offices today. I know that because my wife and I are Dr. Goodman's patients. We know firsthand how concierge healthcare has helped us stay on a path to better outcomes. Welcome to PGX for Pharmacists, Dr. Goodman. Can I call you Michael?
Yes, thank you, Kenneth, for that very gracious introduction.
Well, it's my pleasure. I've known you for a long time, and when people ask me about how RxVIP started, I always say it started at the office of Dr. Michael Goodman. So it's really interesting that you've given us the time now on a Pharmacy Friday, which you and I developed, to talk to our listeners about why a pharmacist can be facilitating patient care within a physician's office. So if you'd be so kind, if you could tell us a little bit about your professional background and the pathway to becoming a concierge physician.
Well, Ken, yes, we do integrate Pharmacy Friday now into our practice. It's very helpful. I started out as an internist in 1980 in the good old days of primary patient care and not worrying about insurance or payments. And then in the late 1990s, when managed care started to take over, we had an influx of patients and we had a practice up to 3,000 people. And I was seeing 25 to 30 people a day, which became clearly intolerable to both the patients and to myself. So I joined nbsp, a concierge medical practice, which limits our patient roster to under 600 patients and allows me to spend the time with each patient that they need and to help them with their medical problems and now their pharmaceutical problems, thanks to you. And it's a much better system. It's enjoyable to both the patients and to me.
That's great, because your perspective on the challenges for patients and physicians in healthcare is really very valuable, because you're right there living, breathing the insurance, prior authorization issues, and the fact that reimbursements for physicians, not just pharmacists, are going down and down and down. And we've all kind of become more administrators and computer EMR experts for billing instead of being clinicians, both as a physician and as a pharmacist. Can you touch on some of those challenges that you've experienced personally here in your practice?
Well, you've outlined them very well. My practice went from one of thinking about patients' diagnoses and problems to how are they going to get their medications, how are we going to have the time to fill their prior authorizations, how are we going to get reimbursed for the diagnoses and the care that we dispense in the office. So it's become administratively top-heavy, unfortunately, to the detriment of the patient and to the physicians.
So when I came to you out of a sense of need to change my life as a pharmacist, I basically said collaborating with a physician for me as a pharmacist was really the only way I was going to reach those patients, because trying to talk to them through drive-through windows and in a high-paced retail environment, just like you had those challenges in your office, became unbelievably challenging.
Yes, it is indeed a challenge. We were spending more time administratively than we wanted to do, and especially from the pharmaceutical point of view. We would prescribe one medication, patient would go to their local pharmacy, find out they couldn't have that because of their insurance or whatever reason. They'd come back, we'd fill a second prescription, and around and would turn 3 and 4 phone calls for every prescription for hydrochlorothiazide or something simple. So I asked you to help me with this particular problem, and that's how we started our mutual endeavor with medicine and pharmacology.
Well, what's interesting is that we had to find a way to introduce that pharmacist to your practice, and you were so kind and generous to allow me to create the Pharmacy Friday concept. I was able to come in and meet with patients at your direction of people within your practice who you felt could benefit by having the time to sit with a pharmacist whose only focus really at that point was helping them save money on prescription medication. So I thank you. And actually, the profession of pharmacy thanks you, because the Pharmacy Friday RxVIP concierge model has grown over the last several years because it started here. So I wanted to personally thank you for your support.
You're welcome, and it's very successful. The brown bag, bring in your medication, review them with the pharmacist who's in the office, worked out really well. Patients appreciated it, and it was very helpful to me as well.
I remember the first time we talked about doing a patient event, and you cautioned me. You said, I've done events on diabetes, cardiology, heart, all the issues, and, we get a couple of people come in, maybe they have those diseases and are interested in learning more, or maybe they just don't have anything to do on that day. And you cautioned me not to be disappointed if we didn't get a good response. So we did an event, and we really just focused on what I believe is the chronic disease we all have, is nobody can afford the medications that they are prescribed. So we use that as a resonating point. And if you could tell our listeners, we started with a 10 o'clock appointment, and then we kind of went from there because the response was excellent.
Yes, it was very simple. We invited a number of patients who had generally more than 5 or 6 medications that they were taking, asked them to come in at a specific hour, had a very informal meeting. I introduced Ken. He introduced his concept of Pharmacy Friday, and it's been very helpful and successful.
Well, we're thrilled because it allowed me and all the people who you've been generous enough to allow me to bring in to your facility to train and mentor the students and the other pharmacists. You kind of look at me sometimes as that I'm just have a revolving door of bringing more and more people interested in doing what we do. So outside of taking up parking spaces on snowy days, we've tried to be very accommodating to you and your staff and be here as support people, not to get in your way.
Well, it's very helpful, and it's advantageous to me as well, because when we come to the dispensing medication aspect of their visits, I can say, we have a professional pharmacist in the next room, and he can go over the medications that you need and all the ancillary paperwork that goes with obtaining those medications.
Well, we've been very fortunate to see measurable, actionable results from our efforts with you. So the patients seem to like the concept, which if the patients like it, then we're going to give it more and more attention, and that's what we've done. This show is called PGX for Pharmacists. So the founder of the network and the publisher of Pharmacy Podcast Network would kind of call me out if I didn't mention and focus on pharmacogenetics and what your feelings are for the value and future use of pharmacogenetics in prescribing medications.
Well, I think it's definitely on the forefront of medicine in general, and probably dentistry and other health-related care. Everybody's using genetics, pharmacogenetics, cancer genetics, disease-focused genetics is the wave of the future to diagnose and to help provide appropriate medications that are not just randomly picked out of a basket, but chosen with some intelligence and some knowledge about how they're metabolized and handled by a specific patient.
Have you seen through the testing that we did here in the practice, ability to reduce that trial and error, for lack of a better word, for the medications that you prescribe?
Yes. If I need to pick a new medication, I now go to the pharmacogenetic panel or profile and scroll through the choices that are there and not use the ones that are cautioned or advised not to use, and pick the more appropriate medication for the intended purpose.
So really, the tests are kind of like a blueprint. I remember you mentioning to me, if you bought a refrigerator, wouldn't you want to know what the guide, the fix-it guide was? So these reports give you kind of the blueprint to that patient for future prescribing, because sadly, people develop disease states down the road. And if we can avoid that trial and error and give them the right drug, the right dose, right from the beginning, that's a measurable impact on patient care.
Yes, I use it as a glossary or an index, I guess you'd call it, in the back of a book. If someone has hypertension and I want to pick out the more appropriate ACE inhibitor, I know where to look and which one to choose.
So for patients who sadly are on polypharmacy, which are initially the ones we selected from the practice, have you seen any actionable results from the test results that have made changes to the medication protocols that you were utilizing at that time?
Yes, we've taken patients off some, quote, unsafe drugs and put them on more appropriate medications, and hopefully have averted any catastrophic problems or potential misuse of medications.
So the role of the pharmacist in that reviewing process, you're pretty busy. I stand here a lot and I watch you running around to offer the high level of patient care that you deliver. But if a report comes in that's 30 or 35 pages that details 300 to 400 medications, do you have the time to take that information and look at it from a clinical perspective of what you may or may not be doing?
Well, we get a summary from you and your cohorts, which is, of course, helpful. But if I have to, I do page through those numerous pages of information and make a more clinically correct decision. So
one of the things that we do by being here is save some time to produce a single-page report that allows you to kind of see a synopsis of what that patient's genetic profile is relative to the existing medications that they are being prescribed by you. So
yes.
We're kind of helping out.
Yes, of course, for sure. We actually bring the patient in at their next visit or whenever it's appropriate and go over that with them and give them that summary, that single page or dual page perspective of what was found out on their full pharmacogenetic profile.
Well, what's interesting is when I started here, I wasn't doing pharmacogenetic testing with you. Our relationship started back in 2014 when chronic care management was introduced by CMS for Medicare patients who have 2 or more chronic diseases. And I came to you and I said, this is a service that really you're doing anyway as a practitioner, but we gave you the opportunity to kind of take part of that off your plate and deliver those services. So when we started, chronic care management was really the reason we wanted to take care of and coordinate care for your patients. Can we talk a little about your perspective of chronic care management for the patients that you have?
Well, I think it's a great idea. I'm happy now that we can get some reimbursement for this service that we generally did prior. And you call the patients and ask them how their particular problems are, if they're taking their medications appropriately, and it allows us to identify any shortcomings in their use of their medications and get the patients back in and address the problems more correctly.
And it was really great to allow me personally to interact with your patients, because healthcare is about relationships. I learned that by being your patient and you taking the time and making the time to guide me on a path to better health. And now as a pharmacist who was looking for a place to hang his hat for the balance of his career, and then after he retired, the ability to work collaboratively with a physician, and a physician like yourself who recognizes the value of a pharmacist, has been an extraordinary personal and professional experience. So I just need to thank you over and over again for
Well, I'm glad you appreciate it, and I've told a lot of my colleagues, we chat and they say, what's new? And I say, hey, I have a pharmacist who's in my office full-time, and any problems related to that aspect of medicine is now handled in a more professional manner.
Yep. And when we started, it was Pharmacy Friday, one day a week. Now you're kind of stuck with me maybe more days than just that, because the more patient care we can deliver and the more lives we can impact, the RxVIP concierge model, which was born here in Belmore at the office of Dr. Michael Goodman, is now impacting thousands and thousands and thousands of lives. So you are a thought leader, not just in concierge medicine, but you have kind of been responsible for allowing me to forge a pathway that any pharmacist, any PharmD, and more importantly, any student of pharmacy can learn how to be a care provider.
Well, thanks again, and I really do hope that this model of integrating pharmacology and medicine gets propagated to the healthcare system in general, because it's necessary now.
Well, certainly with the changes in the landscape, through change comes opportunity. So all the listeners out there who are thinking about the challenges they have in retail pharmacy, and that's kind of the norm. There's nothing wrong with being a retail pharmacist. I was a retail pharmacy. There's a need to dispense the medication, but to dispense care, compassion, and empathy to patients in a medical environment that just is built for that has allowed pharmacists to truly become care providers. So we believe it's an important part of the healthcare system, and mentoring the next generation of PharmDs on how to become concierge pharmacists is something that goes on every day at the office of Dr. Michael Goodman.
Thank you, Ken.
Well, we thank you. We want to tell our listeners that this is the first of a series of ongoing Ask Your Doctor about pharmacogenetic testing initiatives. As a company, we believe that part of our goal as pharmacists is to raise awareness with physicians like Dr. Goodman and others about the value of incorporating pharmacogenetic testing into their practice. So as we move forward, RxVIP will be offering every pharmacist, PharmD, and student of pharmacy the opportunity to create their own collaborative practice agreements with physicians all over the country and in their neighborhoods so that they can deliver patient-centric care, just like we're doing here in Belmore and the other practices that we've developed over the last several years. I want to thank Dr. Goodman and his entire staff, who have been extremely supportive of our initiatives, for allowing us to create a paradigm shift for the way pharmacists can practice their profession. Thank you, Dr. Goodman.
You are welcome. Thank you.
And that concludes today's pharmacy podcast, PGX for Pharmacists. We are changing the DNA of the pharmacy profession, one patient at a time, and we say thank you. Enjoy the rest of your day.